Most parents walk into vaccine day with a knot in their stomach. You know what's coming. The nurse prepares the needle, you hold your baby tight, and then comes that cry. That sharp, heartbroken cry that makes every single parent in that room feel like the worst person alive. And here's what no one tells you. The way most parents respond in that moment, the tension, the anxious voice, the rushed apology, actually makes it worse. Not because you're doing something wrong, but because your baby's nervous system is reading every signal your body is sending. But what if you could change all of that with one simple technique? Something you can do right there in the doctor's office, with zero preparation, zero cost, and zero special equipment. What if that cry could go from 5 minutes of inconsolable screaming down to 60 seconds of calm? That's not a promise I'm making up. That's what the research actually shows. And in this video, I'm going to walk you through exactly what it is, exactly why it works, and exactly how to do it, step by step. Hi, I'm Ava Marco from Baby Brain Blueprint, where we translate the science of early brain development into tools you can actually use as a parent. And today's tool might be the most immediately practical one I've ever shared. Let's talk about what actually happens on vaccine day, because most of us have been thinking about it wrong. The common assumption is that a baby cries during a shot because the needle hurts. And yes, the needle does hurt. But here's what the science tells us. A significant part of your baby's distress response is triggered before the needle even touches their skin. Babies don't understand what a vaccine is. They don't know what a doctor's office is for. What they do understand, with absolute precision, is you, your face, your posture, your voice, your breathing. When you tense your shoulders, when your voice goes high and fast, when your eyes go wide with worry, your baby's nervous system reads that as something dangerous is happening. And their stress response fires up to match yours. So by the time that needle arrives, they're already flooded with cortisol, already primed for maximum distress. The shot doesn't create the trauma, the anticipatory stress does. Now here's the part that changes everything. Your baby's pain experience is not fixed. It is not a set number that the needle produces and the baby receives. Pain, especially in infants, is modulated by the nervous system in real time based on the inputs it's receiving simultaneously. That means you have more influence over your baby's pain response than you've probably ever been told. And that influence doesn't require a prescription. It doesn't require a specialist. It just requires understanding how your baby's brain actually works. In the 1960s, two scientists named Melzack and Wall proposed something called the gate control theory of pain. And it changed medicine. The basic idea is this. Your nervous system has a gate, a filtering mechanism in your spinal cord, that determines how much pain signal actually reaches your brain. And here's the key. That gate can be opened or closed depending on what other signals are competing for attention at the same time. Strong competing inputs, warmth, pressure, touch, the taste of something sweet, the sound of a familiar voice. These signals travel faster along certain nerve fibers than pain signals do. They reach the gate first. And when enough of them arrive together, the gate partially closes on the pain. Your baby is not immune to pain, but their experience of that pain can be significantly reduced in real time by flooding their nervous system with the right comfort signals at exactly the right moment. And what are those signals? Skin-to-skin contact, sucking, your calm, low voice. Those three things, working together, are scientifically documented to reduce infant pain response, not by a little but significantly. A 2016 Cochrane review, one of the most rigorous types of scientific analysis that exists, looked at dozens of studies on breastfeeding during vaccination. The conclusion: breastfed babies during shots cried for measurably less time, showed lower heart rate elevations, and had lower cortisol levels than babies who were held or laid flat. A separate study published in the journal Pediatrics found that skin-to-skin contact alone reduced crying duration by nearly 50% in newborns during heel-stick blood draws, a procedure that causes significant pain. And sucking? Whether from the breast, a pacifier, or a small amount of sucrose solution, the act of sucking activates the body's endogenous opioid system. That's your baby's built-in pain relief. It doesn't require a drug. It's already inside them. You just have to activate it. You are not a helpless bystander on vaccine day. You are your baby's most powerful pain management tool. And now I'm going to show you exactly how to use that. Before I walk you through the step-by-step, I want to take a quick second to tell you about something that genuinely aligns with everything we talk about on this channel. Just like your baby's pain system responds to the right inputs at the right time, their reading brain works the same way. There's a critical window in early childhood when phonics instruction lands differently, deeper, faster, and in a way that builds real cognitive architecture, not just memorization. That's exactly what Phonics Foundations by Children Learning Reading is designed around. It's not a screen-based program. It's a structured, parent-led system that takes maybe 15 minutes a day, and the results parents are reporting are genuinely remarkable. If you want to give your child the kind of early literacy foundation that changes their entire academic trajectory, the link is in the description below. Go check it out. Okay, let's talk about exactly what to do on shot day. The technique I'm about to describe combines three elements that work synergistically, meaning they don't just add together, they multiply each other's effect. You want all three happening simultaneously. That is what the research tested. That is what produces the dramatic results. The three elements are skin-to-skin contact, sucking, and your calm, regulated voice. Let's walk through how to implement each one. Step 1. The first step happens before you even pull into the parking lot. If you are breastfeeding, feed your baby within 30 minutes before the appointment. You want them fed and settled, not starving and already fussy, but also not so full they're drowsy and unresponsive. That window, 30 minutes before, tends to be optimal. If you are not breastfeeding, bring a pacifier. If your baby doesn't use a pacifier, ask your pediatrician in advance about sucrose solution, a small amount of sugar water that you can apply to a pacifier or a gloved finger right before the injection. The standard study dose is about 2 milliliters of a 24% sucrose solution. Your doctor can prescribe it or tell you where to get it. It's inexpensive, it's safe, and it works. And for yourself, I know this sounds simple, but it matters. Take 3 slow breaths in the car before you go in. Your nervous system regulation is the foundation that your baby's regulation sits on. They cannot be calmer than you are. Step 2. When you arrive, if it's at all possible, hold your baby against your bare chest or inside your shirt. Many parents do this by simply unbuttoning the top few buttons and tucking baby inside. This isn't just warmth. Skin-to-skin contact triggers the release of oxytocin, often called the bonding hormone, in both you and your baby. Oxytocin is a natural analgesic. It doesn't just make your baby feel close to you. It literally reduces their pain sensitivity at a neurochemical level. While you're waiting, keep your voice low and slow. You don't need to say anything profound. I'm here. I've got you. We're okay. Said slowly, with a calm breath between sentences, in that low register you use when you're completely relaxed. Your baby cannot understand a single word of that. But the tone, the rhythm, the pace, the pitch, those are signals their brain has been reading since they were in the womb. A low, slow, steady voice means, the person I trust most is calm. Therefore, I am safe. Step 3. Here is the single most important timing detail in this entire video. Most parents wait until the needle goes in to start comforting their baby. By then, you're behind. The stress response has already fired. You want the comfort input running 30 seconds before the injection. That gives your baby's nervous system time to shift into a regulated state before the pain signal arrives. The gate needs to be partially closed before the needle comes, not after. So when the nurse tells you they're about to give the injection, that's your cue. Start breastfeeding now. Or offer the pacifier now. Or apply the sucrose now. Don't wait for the cry. Get ahead of it. Step 4. Keep feeding. Keep the pacifier in. Keep talking, slowly, gently, at low volume. Here is what not to do in this moment. Don't suddenly go silent. Don't hold your breath. Don't tense your arms around your baby. All 3 of those things communicate danger to your baby's nervous system. Instead, keep your breathing audible and slow. Keep the words coming. I've got you, you're safe. I'm right here. Like a slow, gentle rhythm. The content doesn't matter. The steadiness does. Your baby may still cry. That's okay. That's normal. You're not trying to produce a baby who doesn't react at all. You're regulating the intensity and shortening the recovery. There's a difference. Step 5. Most parents, the second the injection is done, immediately start trying to dress their baby, pack the bag, thank the nurse, get out of the room. And I completely understand that impulse. You want out. You did it. It's over. But cortisol, the stress hormone, peaks about 2 to 3 minutes after the stressor, which means the most intense physiological stress your baby experiences from a vaccination often happens after the needle is gone.
So stay.
Hold your baby skin to skin for at least 5 minutes post-injection. Keep nursing or keep the pacifier in. Let their nervous system complete the recovery cycle before you transition them. Parents who do this consistently report that their babies are calm and often drowsy by the time they leave the clinic, instead of screaming the entire car ride home. I want to quickly walk through the 3 most common things parents do on vaccine day that unintentionally amplify their baby's distress, because awareness of these is just as important as knowing the technique. Mistake number 1. Apologizing in a panicked voice. I know how natural this is. I'm so sorry, baby, I'm so sorry. But say it again in your head and notice the pitch, the speed, the breathiness. That vocal pattern, high, fast, tight, is one of the primary distress signals your baby's brain is wired to detect. You're trying to comfort them, but your voice is saying, I am scared. They hear the voice, not the words. Mistake number 2, laying baby flat on the examination table with no contact. This removes all 3 comfort pillars at once. No warmth, no skin contact, no sucking. The baby is alone on a cold surface with strangers approaching. Their threat response has nothing to counteract it. Many nurses are completely accommodating when parents ask to hold their baby for the shot. Just ask. Most will say yes. Mistake number 3, rushing out immediately after. We covered the cortisol peak. Don't skip the recovery window. The 5 minutes you spend holding your baby after the injection pay dividends that last for weeks. You are teaching their nervous system that distress passes, that you are reliably there, and that the world returns to safe after something hard.
That is not a small thing.
That is the foundation of emotional resilience. Vaccine day doesn't have to be the thing you dread. It doesn't have to be traumatic for your baby or for you. The hack isn't complicated.
Skin to skin. Sucking.
Your calm voice. 30 seconds before the needle. 5 minutes after. That's it. That's the whole thing. But here's what makes it powerful. When you understand why it works, when you understand that you are your baby's nervous system regulator, that your calm literally becomes their calm, it changes more than just vaccine day. It changes how you show up in every hard moment. If this video helped you, share it. Send it to a parent who has a vaccination appointment coming up. It takes 5 seconds to share, and it might genuinely change their experience. If you want more science-backed tools for your baby's brain development, the kind of things that actually move the needle, subscribe to Baby Brain Blueprint. I post every week. I'm Ava Marco. You've got this. And I'll see you in the next one.